Welcome to EKG Lab Live, brought to you by Whole Life Healthcare. Today we're doing a deep dive into something that, well, it might be the single most critical factor in any high-stakes clinical setting.
Clinical trust.
Exactly. Clinical trust. We're going to explore why some telemetry techs and RNs are the ones everyone listens to, while others, sometimes get tuned out.
It really is the invisible currency of a care team, and it completely changes patient outcomes. We're not talking about your credentials here or, how many years you've been on the job.
No.
We're talking about the real-world behaviors that make you the person everyone looks to when a code is called.
That's our mission today. We want to break down how you become that steady center of gravity when a patient is in crisis.
Right.
We're going beyond just rhythm interpretation and into the behavioral science of being reliable.
We are. And when you look at the foundation of it all, the sources are really clear. Clinicians are trusted because of their consistency. It's about their professional values, not just their job title.
Okay, let's unpack that word, consistency. Because that ties right into someone's demeanor, doesn't it? The sources mention something called emotional fortitude.
Right.
That sounds very formal. What does that actually look like on a busy cardiac unit?
It's simpler than it sounds. It's basically the ability to separate your emotions from your clinical duties.
Okay.
Emotional fortitude just means you have the stability to use your brain to think clearly, even when you're facing, huge uncertainties or a ton of stress.
You don't panic.
You don't panic. You can function independently, use sound judgment, and you trust your system, even if the world around you is just chaos.
I'm glad you brought that up because it sounds almost too simple. Don't panic. But when the pressure is on, a rapid response, a patient suddenly deteriorating, panic is a pretty natural reaction.
It is. But that fortitude, that stability, it translates directly into your actions, specifically your communication.
How so?
Well, if you're emotionally stable, you speak clearly, you're specific, you build that professional rapport with the patient, with your colleagues, with the doctor you're calling. If you're rattled, your report is going to be vague or rushed.
And vagueness kills trust. Because now the doctor has to sort of triage your report before they can even get to the patient. They start questioning the messenger.
Exactly. And that leads to a really critical difference in how trusted clinicians approach the EKG itself.
Which is what?
They prioritize describing what they see, the objective evidence on that strip. They describe it before they ever try to name or label the rhythm.
Evidence first, label second. That seems like it's the perfect defense against the single biggest trust killer, which I assume is the guessing game.
It is absolutely the biggest killer of credibility. Trust is just, poof, gone the moment a clinician starts overcalling rhythms or sounds unsure or is just guessing out loud.
Okay, but let me challenge that for a second. In a critical situation, time is everything. If I see a wide, fast rhythm, isn't it better to just call it VT ventricular tachycardia and be safe than sorry? Why is that so bad?
Because the cost of a false alarm is huge. It's clinical fatigue. If you consistently call every fast rhythm VT, even when it's just, a fast sinus rhythm, the team gets alarm fatigue. They just stop listening.
So when you really need them.
When a true emergency arises, their attention isn't there. That loss of trust, it literally costs lives.
That's profound. So your credibility is this finite resource, and every time you cry wolf, you're using it up.
Precisely. Confidence isn't loud, it's accurate. And telling the difference requires a structured approach, not just a gut feeling. And remember, interpretation is our job, yes, but actual diagnosis, that belongs to the MD.
So when you guess, you're both overstepping and underserving the patient. So if accuracy is the foundation, let's talk about the technical side, because bad data in means bad data out. What are some of those basic technical failures that just destroy trust from the get-go?
Well, it's what the standards call a departure from the minimal standard of care. Basically, it's sloppy work, and it often starts with patient prep.
Just the basics.
The absolute basics. Your interpretation is only as good as the waveform you get. If that waveform quality is poor, the monitor might not even recognize the R wave correctly.
We were just talking about skin prep, right? Wiping the skin, maybe a little abrasion. I think a lot of people, when they're rushed, see that as a step they can skip.
And that's a huge mistake. You have to think like an electrical engineer for a second. That top layer of skin, the stratum corneum, it's basically a giant resistor.
It blocks the signal.
It has a really high impedance. If you don't clean off the oils, clear the hair, and lightly abrade the skin, you're fighting that resistance. The machine tries to compensate, but the waveform quality just plummets. You get artifact, you get baseline wander.
So skipping those 10 seconds of prep is basically sabotaging the EKG.
Yeah.
And the team sees it as This tech is giving us noise, not data.
Exactly. And that noise can look like a life-threatening rhythm. But it goes beyond skin prep. The single biggest reason for an inaccurate ECG interpretation.
What is it?
Improper electrode placement, especially misplacing the precordial leads.
That's staggering. I mean, how much does a slight misplacement matter?
It can be clinically significant. Moving V1 or V2 even slightly can create changes that mimic a serious heart attack or, hypertrophy. If you're not consistently using your landmark's fourth intercostal space, mid-axillary line, you're baking bias right into the data.
And when the doctor sees a strip that doesn't match the patient, the data gets thrown out, and so does their trust in the tech who took it, which leads right into the third trust killer, letting your assumptions override the evidence.
Cognitive bias. You mean like seeing what you expect to see based on the patient's history?
Precisely. It's often anchoring bias. Let's say you know a patient is a, quote, frequent flyer for anxiety. That becomes your anchor.
So when they report chest pain and you see a tiny nonspecific T-wave change, your brain immediately jumps to anxiety, not this could be an early ischemic event.
And that assumption makes you downplay what you're actually seeing on the monitor.
Yes. You might chalk it up to artifact because it confirms what you already believed. A trusted clinician has to fight that. They have to exercise independent judgment and be willing to admit when the evidence contradicts the history.
So if those are the pitfalls, the guessing, the sloppy technique, the bias, what are the most trusted clinicians doing differently? What's the flip side?
They rely on a system, not raw instinct. Instinct is great, but under pressure, it can fail you. A system won't. They use a repeatable, objective method every single time they look at a rhythm.
They have a checklist in their head.
Essentially, yeah. They follow the steps. They don't just feel what the rhythm is.
So give me an example. What does that objective-first approach actually sound like when you're escalating a rhythm to a nurse or a doctor?
Well, it means you have the education to really know what you're looking at. So you don't walk up and say, I think he might be an AFib.
You lead with the data?
You lead with the data. You say, I have a sudden rate increase to 165. The rhythm is irregular. There are no discernible P waves, and the QRS is narrow. I need you to look at this right now.
That's a world of difference. That specificity shows you've done your homework. You're escalating facts, not a guess.
And that's what builds trust. It saves time, and it prevents putting the patient in unnecessary danger.
It's just so interesting that this is the same lesson we're seeing AI systems learn. They're being designed to mimic this exact high-trust human approach.
They are. The AI is learning to follow a structured process. It weighs evidence for and against a condition, piece by piece, observation by observation.
So whether you're a human or a machine, the only reliable way to work in these high-stakes situations is to lean on a structured, repeatable system, not just instinct.
That's it. That's the core takeaway.
And having that system is what protects you from the panic, from the technical errors, from the cognitive bias we talked about.
Exactly. You need a process that simplifies the complexity and makes those critical checks, like being objective before you label something, just part of your muscle memory.
Which is really why the EKG Survival Pack from Whole Life Healthcare exists. It was designed to give you that very structure.
It is. It helps reduce all that guesswork by teaching a clear, step-by-step method for analyzing any rhythm. It forces you to be objective before you jump to a conclusion.
So it's a repeatable approach that helps you stay accurate and stable, even under pressure. It ensures you're delivering the highest standard of care when it matters the most. It's really the tool for anyone who wants to become that trusted person in the room.
That's the whole goal. Use your system to conquer instinct.
Remember, trust is earned one accurate call, one consistent demeanor, and one professional interaction at a time. Be the steady, reliable guide that your team depends on.
We hope these insights really help you strengthen your own practice.
Thank you for joining this deep dive on EKG Lab Live. We look forward to having you back next time for more practical clinical insight from Whole Life Healthcare.